or you can contact me here at the Next Level Studios, which is 310-549-1113, 310-549-1113. Now, also, if you missed a live broadcast show, you can also go there and click on previous tab to watch the show anytime. Tell your friends and family so they can be updated with the latest information. Also, the producer of the show is T Jams. That's TJAMZ. And you can reach him at tjamsmusic.com. He writes all the songs for the show. There's a whole list of songs on his website. He also does web design. So you can contact him at his website at tjamsmusic.com, or you can contact him here at the Next Level Studios at 310-549-1113, 310-549-1113. Now, let's get to it. We're going to talk about the updates. Now, I usually get my information from CDC, Cal OSHA. I get my statistic numbers from World Media website. Now, also, I wanted to let you know the current numbers. So let's just get to it. Every time I do a show, the numbers are increasing. So that tells you that this is not over. It is not over. So worldwide, as of today, we currently have 140,649,900 cases. This is worldwide. And deaths, we're past the 3 million mark now. We're at 3,119,372. Now, there are several million that have survived, but you don't want to get COVID. But the numbers worldwide is 125,167,567 patient or people who have actually contacted COVID and has survived. Now, the U.S., unfortunately, we're leading in deaths and cases. So out of all the whole world, we have the most. So the number of current cases is 32 million. We're all in the millions now. 797,521. So the deaths, staggering number. We pass, we're almost at 586,000. That's terrible. We currently have 585,941. Now, the third leader in cases is Brazil, but as you heard on the news, they're totally out of control. Their cases is 14,308,215. Now, they're the second leader in deaths because they're out of control in Brazil. It's 389,609. Now, COVID, let's go through COVID-19. It's a severe respiratory syndrome coronavirus 2. It's a new virus. It was identified in December 2019. That's why we have COVID-19 because of the year. Now, it started in Wuhan, China. The World Health Organization declared a public emergency of international concerns of COVID-19 on January 30, 2020. Now, they later declared this a pandemic, which means it's across the world. That was done on March 11, 2020. It has spread to 219 countries and territories across the world. The outbreak originally, they say, it was linked to large seafood and animal markets. Also, according to Medscape, on April 9th this year, April 9th, in Saigon, Rutgers, this is from the Rutgers news page, a joint China World Organization investigation and study was on the way. Answers about the pandemic had begun, and more rigorous investigations are required, with or without Beijing's involvement, and a group of international scientists and researchers. The point of the study said likely transmitted route SARS coronavirus 2 virus. The cases COVID-19 involve bats and other wildlife. Well, many theories suggest an animal-to-animal spread. The investigation will continue with the World Health Organization. Later, animal spread then said went to large exposed animal markets. That's how it happened, indicating animal to person, but later then spread across the world. So now we know it's person to person. Now, symptoms appear within 2 to 14 days after exposure to the virus. So if you're exposed to somebody and you start having symptoms 2 to 14 days, then you should go get tested. The incubation period for in the median incubation period of COVID-19 is 4 to 5 days. Most symptomatic people experience symptoms within 2 to 7 days after exposure. Remember, it's from 2 to 14 days. So just because you don't have symptoms after 7 days don't mean you don't have it. You can get it up to 14 days. According to Dr. Fauci, this was for today, we still have approximately 65,000 new daily cases of COVID diagnosed in the country. This is too much already. States should not ease COVID-19 restrictions. It's causing until the restrictions fall under 10,000 per day. So, the states are opening up a lot, and, you still got to practice your protection. Wearing your 2 masks, keeping your distance, and washing your hands frequently, and don't group up outside of your home. Now, according to NBC News just 12 hours ago, even after fully vaccinated, many still have fear of they might catch the COVID. And it's possibly because of the variances, right? Approximately 25% of Americans is fully vaccinated. Per CDC, Pfizer and Moderna is 90% effective, but not sure how long. They're guessing maybe approximately 6 months that your immunity may last. They're not sure yet. Remember, this is a new disease. Now, Johnson & Johnson has 66.3%, but also 100% effective in preventing hospitalizations. Now, they did have a hold on it, and then they restarted, so follow the guidelines. There have been breakthrough cases. These are the ones that are vaccinated, 100% effective. Dr. Adam Rittner, director of Pediatrics Infection Disease in New York University, he says that the vaccine will protect against you needing to go to the hospital, meaning you won't get the severity of the COVID-19 and you probably won't die. That's why it's important for everybody to get the vaccine. Ending up to CDC also among breakthrough cases, they said there's about 7%. Now, these are the people who are fully vaccinated. There's still about 7% people who have breakthrough with the coronavirus and required hospitalization. Per CDC, there was 74 people who have died. This is after they've been vaccinated. So they still got breakthrough COVID. You can have up to 7% of the population, and 94 people actually die. So hence, this is important to continue the safeguards. The death represents less than 0.1000%. So still a small amount when you look at millions, but it's still possible. All the fully vaccinated people, these are the people that were already fully vaccinated, meaning 2 shots. Now, a lot of people, there was 140 million people that was vaccinated with 1 shot, but only 93 million went back for their 2nd shot. So that means 8% of people who got 1 shot have still not got their 2nd shot. You need both shots to get the full immunity. And with 1 shot, there's limited to the amount of time that you're going to have immunity. It's still new, but you should go back and get your 2nd shot. So we continue to have increased deaths and cases every day. So it's not over. Per Dr. Goldwyn Vimina, the road race between getting enough people vaccinated and achieving more immunity before the variants can continue to spread, mutate, and continue to get stronger. People who are not vaccinated, they're going out there, they're going to get the variances, they're still going to get the COVID. So us that are already fully vaccinated, it was possible we can get one of the variants because they're not vaccinated yet. So we have about 30% of the population that's vaccinated. That's still not enough. We need about, they said 75 to 80% at least vaccinated. So you guys, please go get your vaccine shots. COVID-19 symptoms are wide range, and it can be like a light flu or it can be more serious. Some of the symptoms include fever, 100.4, not 104, 100.4. You can get fatigue, you can get shortness of breath. Now the fever can get higher, and that's dangerous, so you need to make sure you go in. You get chills, you get those repeated chills that are like make you move and they hurt, they're painful. Headaches, you can have headaches, muscle and body aches, sore throat, nausea, vomiting, diarrhea, congestion, runny nose. Some of those are the symptoms of the flu, but get yourself checked. Notify your doctor. Don't hesitate. Also, new symptoms include things more recent like hiccups. It can happen several days before you actually develop COVID. So if you're having hiccups, you need to call your doctor and get tested. Also, a new loss of taste or smell. COVID-19 can cause more severe respiratory illness, which are, let me tell you some of the emergency warnings. If you have trouble breathing, persistent pain or pressure in your chest, like someone's actually sitting on your chest, but you know there's no one there. Also, new confusion, bluish, purple, grayish lips. It depends on your skin tone. It could be on your lips and your face. Darker pigment tends to have more of a grayish look to it. So it just depends on how much pigmentation you have in your skin, where you see those colors or not. But you can tell the difference. Now, who's more vulnerable? It used to be, well, it still is, 65 and older with comorbidity diagnosis. They're still dying at the higher rates than any other age population. But we have increased deaths in infants and young children as well. They're getting more COVID. So no one is exempt from getting COVID. So protect your children as well. Now, some of the underlying conditions that may warrant you maybe getting severe COVID and getting admitted to ICU and hospitalization and getting on ventilation or possible death. Additional underlying conditions include heart disease, stroke, hypertension, chronic respiratory disease, asthma. Hey, watch your children, because children tend to go de-escalate very quickly. So if your child is sick, don't hesitate. Don't wait till in the morning. In the morning may be too late. Now, asthma, you have to make sure they have a current inhaler. Make sure that you check the expiration date on the actual inhaler. It's usually on the bottom of the inhaler, but if it's in the socket for the pump, it's going to be, you'll see it at the top in a black area. Make sure that's current. Also, just below that is a counter. It tells you how many puffs are left in the inhaler. It's very important that they have this on site, because it takes several minutes before the paramedics can arrive. You can help save your child with current medication available. Make sure it's not expired. Also, there's other lung diseases like COPD, chronic pulmonary obstruction disease, chronic kidney disease, sickle cell anemia, liver disease, cancer, autoimmune suppressive diseases like HIV, leukemia, lupus, sarcoidosis. Also, cancer, like if you're post-chemotherapy, it lowers your immune system because it not only fights the bad cancer cells, but it fights the good cells too. So that's why you're more at risk. Type 2 and 1 diabetes, smoking, pregnancy, and obesity. So children returning to schools now, they're opening up. Make sure you're teaching your child to wear their mask. I mean, practice it at home so that they get used to wearing their mask, so they don't take their mask off. I don't agree with kids going back to school at this point, but I have to give you the guidance that goes with it. Signs and symptoms to watch for your children who have COVID, and things that when you should take the actions, okay? According to Medscape, children likely to lead up on the leading edge of the COVID variances, because, they weren't susceptible before, but now they are. So it's more resistant. And this is per Brenda Goodman on April 1st, 2021. Public health officials in Midwest and Northeast are sounding the alarm about steep new increases of COVID cases in children. Increases seem to be driven by greater circulation of more variants that are going on. Just as children and teens are returning to in-person activities, some come from sports, parties and classes. I can just tell you from his 46-year history in the business, he said he's never seen a dramatic transmission in kids like that they're having right now in Minnesota. Young kids, says Michael Osterholm. He's a Dr. Osterholm, he directs the Center of Infectious Disease Research Policy at the University of Minnesota, Minneapolis. Now, this is what he's seeing. And right now, we know Minnesota as well as Michigan is out of control. There's still some problems with the UK. Brazil has never been under control, and India still has huge problems as well. Younger children, especially, he's seeing this in minor roles of submitting the infection. But when they are diagnosed with COVID-19, their symptoms tend to be mild or absent for reasons not clearly understood. They're still researching that. Now, governors in some hard-hit states are pleading with a pandemic worry public. Keep your mask on, social distance, avoid gathering outside with other people, unnecessary travel. Now, also for the parents, get your vaccine because you need to protect your kids. Because right now, they're saying that the reopening of youth sports, it has caused the more infection due to the variant, the B11. They're harder to defeat. Over the past month, incidents in this age group has more than doubled in the state. This is in Michigan. Cases among younger children, infants, 9 years, and also going up, increasing more than 230%. 230%. Department of Health, Human Services. Increases have prompted some schools to pause in person. Sorian, senior public health physician with Michigan Health Department in Ann Arbor. In Minnesota, on the recent call for reporters, Ruth Linfield, doctor, the state of epidemiology, said that the B117, which is the UK variant, which has rapidly risen in the state. So this is confirmation that this is rapidly increasing. So you still need to do the protections. Now, Massachusetts has fifth highest number of recorded B117 cases in the U.S., according to the CDC. Although most COVID-19 cases in children and teens are mild, the disease can be severe for those who have underlying medical conditions. So really watch your kids if they have underlying medical conditions. It may trigger what they call a multi-symptom inflammatory syndrome in children, which requires hospitalization. Emergent studies have showed that children, like adults, can develop lingering symptoms of COVID. And recent data from the UK shows 10 to 15% of children younger than 16 infected with COVID still had at least one symptom 5 weeks later. Now, Osterholm said it remains to be seen whether more cases in children will also mean a rise in more serious outcomes in children, as in Europe and in Israel. So in Israel, the B117 variant, which is this UK virus, arrived at the end of December and became dominant in January. By the end of January, the medical centers of Jerusalem had 4 patients with newly opened pandemic. They had to open up pediatric ICU units. The ages of those kids range from 13 days to 2 years. So 13 days old, that's a baby, right? So 13 days old to 2 years. So this is why I'm telling you about this information, so you can protect your children. By early February, the Ministry of Health warned that the county doctors to prepare an imminent upward trend of pediatric COVID-19 cases. They notify hospitals to be ready to be open ICU beds for children with COVID-19, according to Cyril Cohen, instead of laboratory immunities and Berlin University in Renton County, Israel. Now, while COVID-19 fatality rate in children are much lower than adults. At least 279 children have died. So we do have some child deaths across the U.S. since the start of the pandemic. Now, it's more than the previous 10 flu seasons. 10 flu seasons. They only had 188. And as you can see, we had 279 from COVID. So this is no joke. So I want you guys to really take care of your children. Now, there is good news. Like I said, Pfizer has a vaccine from 12 to 15. So that should be rolling out soon too, hopefully. So then those children can be protected. We really want parents, you guys have to get vaccinated. You have to protect your children. That's how you have to look at it. Is that if I get vaccinated, then I'm helping my child. So go get vaccinated. We still have a large number that has not been vaccinated yet. And remember, if you only got one shot, you're not fully protected. You need to get the second shot. Now, children with the multi-inflammatory syndrome, these are serious effects that affects all parts of their body. And they're little, right? So it affects their heart, their lungs, their blood vessels, kidneys, digestive system, brain, skin, or eyes become severely inflamed. If you get redness in your eye, remember like pink eye, but you don't have the crust around the eyes, just redness or inflamed. That's what they mean by inflamed, redness, swelling, right? Then you need to notify your doctor right away. A lot of times, the reason they found out too, by testing the children, and found out that they had the antibodies in their test results. So children with this multi-inflammatory syndrome, they can die very quickly. So you don't want to wait. Possible signs and symptoms include fever in the last 24 hours or longer, vomiting, diarrhea, pain of the stomach. Watch your child's nonverbal, because they tend to hold their stomach sometimes. If they can't speak, they'll hold what's bothering them. So watch them as well. Skin rashes, fast heart rate, rapid breathing, red eyes. Remember I mentioned that. Redness or swelling of the tongue and the lips. It looks like a red strawberry. Feeling unusually tired, restless, or swelling of the hands and feet, headaches. They can get headaches. Kids don't typically get headaches. They don't typically get dizzy. Lightheadedness. Enlarged lymph nodes. You can take your fingers and get to the tip of the ear and just kind of run your hand around their neck, and you can see if there's any swollen areas there. They also have a few right behind their ear and their neck. Now, when you need to take them in right away, these are the emergency signs of that include, if they aren't able to stay awake, or if you can't wake them up, that's a severe problem. Call 911. New confusion, bluish lips or face, or severe stomach pain. If they're moaning and groaning while they're holding their stomach, that's severe stomach pain. So get them to the doctor or call 911. Also, signs and symptoms that are emergent is, you can't wait till the next day for children. So please don't wait. I hear parents all the time, why wait till the morning? No, don't wait, because that could be the difference of life and death for your child. So don't wait. Now, according to the Mayo Clinic, how likely is it for the child to have the COVID? It's about 13%. Now, however, children with underlying conditions, it's an increased level, right? Just like adults with underlying medical conditions. So conditions like obesity. There's an epidemic of obesity for all ages. So we need to start working out. Stay tuned to the end of the show. I'll give you some exercises that you can do while you're sitting, lying, or standing. So hold on to the end of the show. But get healthy foods. There's online ordering, so it doesn't matter if you're close to a big supermarket or not. You can still order fresh vegetables and healthy food online. Children should not be drinking 100% milk because of the fat. So you want to change that. Also, kids with diabetes. A lot of times there are some juvenile diabetes, that kids that have insulin-dependent diabetic when they're at 2. So if your child are having frequent urination, they're throwing up, they want to eat a lot, have them checked because you want to make sure they don't have diabetes. If they do, you want to start taking care of them. Also, asthma is a high risk for serious illness for COVID because remember this disease attacks the lungs. It's respiratory, okay? Genetic conditions affecting the nervous system, metabolic, or also higher risk of serious COVID infection. So you have to watch your children. And you know what? It's always the same stuff that, disproportionately black and Hispanic children have more of these different problems, medical problems. Now, according to Medscape, COVID can kill you months after. So that's the whole part. They call this long haulers, right? Where you can still have lingering disease for several weeks or months later. And some people have died. So according to Ralph Ellis, Brenda Goodman from Minnesota, April 23rd, 2021, long-hauler COVID patients face many health threats, including higher chances of dying within 6 months after they catch the virus. So it's like I said, it's weeks to several months. So don't let your guard down because you had COVID and you think it's over. Don't, because it increases your chance of getting it again. So you also have to be careful if you're still having symptoms of shortness of breath or congestion and runny nose. If you don't feel good, you're tired, let your doctor know about those things. And then your doctor will tell you when it's appropriate for you to get your COVID vaccine. Because even if you had COVID, you still should get your vaccine. So consult with your doctor. Depending on your doctor can advise you on when you should get it. Now, another study released by the CDC on 3 weeks ago also found that lingering symptoms they last among the COVID patients at first they were mild, right? But then they still had lingering symptoms. For the natural study, researchers examined more than 87,000 COVID patients and nearly 5 million control patients with federal database of COVID patients. Had a 59% higher risk of death in 6 months after the infection. So long haulers, meaning it continues to linger, you have to be mindful of your symptoms. And you have to, even if you're fully vaccinated, let's get that straight. Even if you're fully vaccinated, the Pfizer and the Moderna is 2 shots. You have to get that second shot. Remember, there's 93 million that haven't went back to get that second shot. The Johnson & Johnson is 1 shot. But the Pfizer and the Moderna is 2. So you have to make sure you get your shot to make sure you have full immunity. And usually it takes up to 2 weeks after that second dose of your vaccine before you start to be with the immunity. Because your body, remember, it's triggering your body to respond and build up immunities so you can fight it if you have COVID, so you don't have severe disease and so you don't die. So it's still very important that everybody get all of their vaccines to make sure that they're okay. Now, also, you want to make sure that you're exercising. It's very important. And then you want to make sure that you should be exercising at least 60 minutes every day. I know people say it's hard to do, but it's not hard to do. You have to just do it. You have to tell yourself. Your brain is powerful. If your brain tell you got to do it, then you're going to do it. If you tell yourself that you're not going to do it, then you're not going to do it. So you need to do it in order to take care of yourself. Now, also, I want to let you guys know that if you're trying to build your immune, make sure that you have garlic. Garlic helps to build your immunity as well. If you can't eat it every day, get you some garlic pills. Also, zinc products. We have blackberries are excellent for building your immunity up. Blackberries. And what you can do, because they tend to go back very quickly. So wash them and put them in freezer bags, and you can use them whenever you need them. Also, broccoli. Broccoli is great for building the immune system, and so is avocados. Avocados are very good at that. Now, and so are almonds and cashews. So these help to build up your immunity. Now, if you don't like blackberries or certain products that I just mentioned, then you need to get you some zinc. There's zinc supplements. Also, another thing I wanted to let you know is COVID does not like acid products, right? Natural acid products, which means like orange, citric fruit, your orange, your lemon, your lime, your grapefruit, your pineapples. They do not like high acid content. So you can also get this to help kill the virus. Also, I want to make sure that you know that taking vitamin D is very important. They have research that has proven that people who got severe COVID was vitamin D deficient. So what they did is they gave them vitamin D, and it helped to improve their symptoms. So you want to take vitamin D. You also want to take vitamin C every day to help with building your immune system. Okay. Another thing I take is B complex. Because remember I said anemia is another high risk. So you want to make sure you're producing enough red blood cells. You get your thiamine and your folate. All that's in your B complex. Building enough red blood cells as well, which carries your oxygen. So you want to make sure you're doing those things as well. Now, you can also gargle every morning. If you use mouthwash, make sure you it doesn't matter which one. Just gargle. Just when you get up, do a little cough and gargle and rinse really good, because that also helps to kill the coronavirus that lingers in your throat. So this is also proven research. Now, also, you want to make sure that you get stuff to clean your sinus. Like if you've been out for a while, or you want to clean your sinuses out. So there's different products that you can do. Also, this has a bottle, and you can put they have packs already pre-measured, and you put it in with warm water. Don't use cold, because that's pretty shocking to your system. The membranes in your nose is very sensitive. So use warm water, and then you put it to your nose, hold yourself over your sink, and you can wash out all this. It washes your sinuses out, your nose and nasal cavity. They're all connected. ENT, ear, nose, and throat. That's what that's all about. So you can do that to wash yourself and keep yourself. Now, make sure when you're wearing your mask, I also recommend that you get some no-fog goggles to wear. Eyeglasses and also contacts is not eye protection. You want to make sure that it's protected to where the virus doesn't move into your eyes, because you can get it that way from your conjunctiva in your eye. So you want to make sure you get the type of goggles are fog-free. If you have glasses, get the type that's fog-free as well as can fit over your glasses. So you want to make sure it's not the vented type. It's indirect or non-vented, so that the air doesn't get into the side right here, because then you're defeating your whole purpose, right? So you wear your goggles, and then you wear your mask. There are some N95s available now online, so you just have to kind of shop for them to find your N95. Thought I had one here, but I don't. But anyway, this is an N95, but this is what the nurses will wear. They're fit tested. So those are the type of N95 that the healthcare workers will wear. There's K95s. It's all over the place. It's not limited anymore. Now manufacturers have caught up to where there's enough of K95s, and there's a few N95. You have to really search a lot, but there is K95. So you want to put your mask on, right? And then there's a little metal clip here. You want to make sure you take your fingers and make sure it has a tight fit there so that you're protected. Now, also, they recommend you wear 2 masks. So then you can put a cloth mask over it, or a gator or something like that, right? In order to stay protected. So that's what's recommended. So make sure you're wearing your 2 masks and you're wearing your goggles. You can order them online, fog free, to protect yourself. So stay tuned because we're going to come back in a few minutes and I'm going to show you some exercises that you can do that sitting, lying, or standing to help with the weight loss. Okay, see you in a minute. Go down and have your arms working as well, right? This is like the beginning starter, right? Because you want to make sure you're working those abs and hold them in. When you get more advanced, you can scoot down more. Hold your abs in and do the same thing. You want to work your abs, so hold them in. Then when you get more advanced, just go all the way down, right? And come up. Hold your abs in and come up. Hold your abs in. Do 3 sets of 10s, okay? Now, of course you can do more as you move along. Let's finish the rest of the floor stuff. So, since my knees are bent already, you can also do some knee lifts from when you're lying down. So, what you do, always hold your stomach in and then raise your legs. If you can't go all the way, go where you can go. If you have to do one at a time, you can do one at a time. But if you can do both. Hold your abs in. Make sure you keep your back on the floor. Now, when you get more advanced, you can cross your legs to add more weight when you get more advanced. But make sure you still hold your abs in and then rotate which foot is on the top, right? So that's another thing you can do, especially for the lower abs. You can do those. Remember, it's always both sides if you're going to do the extra weight. Okay, everything is both sides. Now, since we're here already, you can do some lifts. You can take the palm of your hands, put them down, and then lift up. You can either do count of 30, 3 sets of 10s, or you can hold it for 30 as well and hold in your abs. Those are the isometric ones when you hold your abs in, right? Now, when you get advanced, when you're here, put your knees a little bit closer and then slowly hold yourself up, holding your abs. See how my feet are moving? They're lowering while I'm holding myself up. That strengthens your core right here, okay? Now, since I'm already flat, we can do scissors. Hold your abs in, right? Hold your abs in. You can do leg lifts, right? Hold your abs in. 3 sets of 10, remember that? And then you can do where you can do both. Little, medium, higher, higher, higher. Remember, hold your abs in. Another thing you can do to make it harder once you get advanced is go slowly while holding your abs in, right? That's another one. Now, let's do one for the side, for your love handles, right? So what you can do is lower your leg. You can't go all the way. Go where you can go until you can go down on one side. And then remember, do it on both sides. Do it on both sides. This is also a good stretch for in here as well when you want to warm down. Now, the next thing you can do is both legs. So go to the side with both legs wherever you can go until you can go all the way. Right? So you're basically going to get to this. And then you're going to go to the other side, which is good right here for your love handles. These are really good for this. So that's what these are, right? You hold your abs in. Now, while your knees are open for this inner thigh, you can just open and close, right? So remember back in the day they had this Thigh Master. You can also put on a resistive band and do that too. To make it a little bit more resistant. But that's when you get stronger, right? So it makes you work a little harder because the resistive band is there. So you can do that when you get a little bit more advanced. Now, there's another one that's for the back of the thighs, the buttocks, and the back fat. So you turn over on your belly. And the object is to raise your knees, your feet up, right? Your heels. So if you can't go all the way, if you have knee problems, you might only be able to go like to right here. But if you don't have knee problems, then you can go all the way. And these are good for those moon crater looks in your thighs. That's what this is good for. okay, and that back fat and buttocks, those craters in your buttocks. Okay. All right, now let's do some standing exercises. Okay, so let's move the blanket out the way. We're gonna get into the standing. Okay, so for standing, the most important thing is to strengthen your core, right? So what you can do is, since you're beginning, you can hold on to something sturdy, like if it's the top of your dresser or a chair that's not moving, and hold yourself up on one leg. Try to do it for at least 30 seconds, because what happens is your abs and your thigh and your buttocks is what's going to hold your balance. And then do the same thing on the other leg. So you're not going to be used to it, so you might need some help, so you might have to hold on. Okay, so don't get discouraged, just keep trying, and then you'll get stronger and stronger. Now, another thing you can do is side lifts, right? Lifting your leg, make sure you're doing both sides, right? You can do those. Another thing you can do is you can do squats. Now, squats, you have to have a broad base. Now, for you to have problems with your knees, I'm going to show you what you got to do. You still have the broad base. But I want you to stick your butt out more, because then it takes the pressure off your knees. So you want to toot your butt out to go down. So then that takes the pressure off your knees if you have knee problems, right? But if you don't have to worry about it. You can just do that. Now, also for standing, you can always do the marches. Get you some weights. Get your arms involved, and trust me, you're feeling it, and you're gonna feel it the next day, especially if you're not used to exercising. It does work. Now, if you don't have weights, you can get some water bottles. It don't matter, canned vegetables or fruit. It don't matter. You don't have to spend money, but the main thing is to exercise, right? Right. Now, I'm gonna show you some standing. I call them standing sit-ups. So if you have knee problems, back problems actually, then you want to go slowly, okay? So just slowly go down here. If you don't have back problems, you can go as fast as you want, right? Make sure you go all the way and come back up, because that's working that ab, right? And then you can mix it up by going to the side. Right? The middle, and then the side. Now, if you can't go all the way, you can go to your knees, calves. You can go to your ankles. You can go to the top of your foot until you can go to the bottom, right? And this is actually a good exercise at the end of your workout to stretch your thigh, the back of your thigh, and your back out. So that's a good one for that. Now, another thing you can do, say for instance you're at work, right? Your body gets kind of stiff and numb. You need to take a break, really, right? You can have it to where your chair is not in a movable position, right? And you can just sit down, get up, sit down. Okay, those are squats, because you're still getting up and you're sitting down, right? So that's another thing you can do to exercise. All right. Now, let's do some with sitting, right? So, since we're here, let's just stay here. So open wide, right? And it's the same premise for this inner thigh right here. So you just open and close, right? So that's for that inner fat right there that rubs together, right? That's what that's for. And then what you can do your scissors here, right? you can do your 4-point lift. You can lift, you can straighten it out, you can bring it back and set it down. So lift, straighten it out, bend it back and set it down. Now remember, this is for both legs, 3 sets of 10 until you get a little bit further, then do 3 sets of 12, 3 sets of 15, whatever, however far you can go. I'm showing you these different exercises so you have several that you can do. Now, another thing you can do, you can do the marches too. Like, you could do individual with your toes. In the meantime, you're working your arms. And then you can do them both at the same time. You can do that too, right? While you're working your arms. Because the more you work together at one time, the more you're going to sweat and burn calories, right? Now, the other thing you can do is you can lift, do some leg lifts. You can do them individual, right? Individual, you can start low until you get high, right? Depending on where you are. And then you can do them together. So you can make sure your back and your stomach your back is back on the back of the chair and your tummy is pulled in. So you can do lifts, you can hold, right? Hold to a count of 30. Make sure you're holding your abs in and your back is up against the back of the chair or the bedboard, wherever you're doing it. And then you can do the lifts. Now, another thing you can do, you can get a resistive band, and then you can do curls. So you can do curls, right, on each one. Do the same thing on each one. Now to make it more resistive and harder, open your legs a little bit wider, pull your band across a little bit wider, and do some more. This gives you more resistance. So, if you don't have the weights, you can do this too as well, right? So this gives you more to deal with. Now, we can also do what I call sit-down sit-up, right? It's all about working this core because the fat is the most unhealthy fat on your body. So I'm still working with mine and everybody else. So anyway, so what you do is you do the same thing. You want to make sure that you go down and you touch the floor, right? Come back up, touch, come back up. If you can't go that far, go where you can go, whether it's your calves or whether it's your ankles or whether it's the top of your feet, until you can go to the floor, right? And then after you do that, then you want to try. So you want to go to the side. You don't want to twist. You just want to go to the side, right? And do those. And remember, these are all 3 sets of 10. So these are the things that you want to do. Now, there's another one. I gave you the scissors, I think. You can do those too as well. You can also, what's another good one is these are more isometric by holding your legs up and just counting to 30. Like straightening and stretching out your foot and just holding it, but you're straightening out your foot. So this is working your thighs, right? It's also working your calves because you're moving your foot down like so, and you count to 30, and then you do it again, right? This is very good if you're sitting at your desk. You can just hold your legs up, and then to add it, make sure you push your toes down to the ground. So you're still doing isometric as well as working your ankles at the same time. And then remember, hold your abs in because that's isometric as well. Isometric just means you have the muscle contracted and it's not doing anything other than holding it. But that's significant because that muscle is still working. So hold it. It's still working because we normally are not contracted, right? So it's still working your muscles. That's isometric. Now, I want to introduce you to This is a peddler. Now, I couldn't lift this thing before, and now I can lift it with no problem, because it takes time. You exercise, you do what you need to do. Now, this is a QB. There's different peddlers on the market. I wore out the other one, so I got the QB. There's a nice little dial on the back of it to give you harder resistance to pedal. And then there's a speedometer at the top. So while you're watching your favorite shows like Queen of the South or Queen Sugar, or if you're into superheroes, you have Supergirl, there's Flash, Superman and Lois, whatever your favorite picture is. So you have no excuse not to exercise. Now, the good thing about this, it can go backwards as well. Now, if you're having knee pains, then you might want to push it back a little further so your knees don't have to come up so far. So depending on what's going on with you, you can still pedal with your QB. Now, of course, it's a good idea, remember I said, to exercise your arm while you're doing your pedaling, because it gives you more chances to burn more calories, right? Now, if you want to introduce a bigger weight, I do that sometimes, like a 5-pounder. So then I'll do one at a time. I'll exercise one arm at a time, right? Say I do a count of 30 on each side, right? And then you rotate it and do the other one. Because of shoulder pain, if you have shoulder problems, you want to rest your arm either on your thigh or on the couch. And then as you're pedaling, you can be working your arm. So you have several different options that you can do as far as working out, right? Now, for the back of the arm, you want to lift up and you want to go this way, right? That's for that arm fat that be jingling like right in here, right? That's what that's for. So you want to get rid of that. So you want to go this way. That works the back of that arm. So, and remember what I said is, if you don't have the weights, you have bottled water, right? You have canned vegetables. You can do whatever you need to do to start exercising. And you're pedaling while you're watching the TV show. So if you're, say, 3 commercials, depending on the show. Some have fewer commercials than others. But by the time you are through watching the show, you've done 60 minutes. Now, if it's recorded and you're doing a playback and you fast through the commercials, that's only 45. So you have to make sure you do 15 minutes of another show in order to get you up to 60 minutes. Now, sometimes I push myself. Sometimes I do an hour and 15, hour 30, and sometimes I do 2 hours. That's a lot of work, but hey, you know what? You got to get it in when you can fit it in. But you got to do at least 60 minutes every single day, because this is our health. And you don't want to become a type 2 diabetic because you're gaining too much weight and you're eating too much junk food. Now, your serving sizes should be 50% vegetables or fruit, not potatoes, not fries. No kid should have a super size of anything or large of anything. There's plenty of air fryers on the market. You don't have to be using oil as much. Invest in your health. Take care of yourself. Cook at home. There's too many products out there that you can use yourself to cook. And even some of them you can cook overnight. You can make a pot of chili. You can roast beef and vegetables together. I mean, there's a lot of things you can do. But I want you to be healthy. Now, just remember that in order to build your immune, you can eat broccoli. You can eat avocado. Is great for building immunity and an acid product food, right? Yeah. And blackberries are very good to build your immune system. Okay? Now remember, the coronavirus don't like acid foods. So you want to eat your lemons, your limes, your orange, your grapefruits, your pineapple, everything that has acid in it. They don't like that. Coronavirus doesn't like it. So these are great fruits, including the avocado. Remember, avocado is good for building immune as well as increasing acid content in your system that coronavirus does not like. So remember, you got to continue to, wipe down your products that you bring in from the store, or when your packages that are delivered. You can get you a plastic bottle and get you some bleach. It's only 1/3 of bleach per water. So you can have your own bottle of spray, and that'll last you a long time. Also, you can use antibacterial soap in a washcloth to wipe your products down as well when they come in. So that'll help save you some money too. So you don't be spending all that money on them Clorox and Lysol wipes. You don't need that when you can just use your towels, okay? Or make your own spray solution. You can also spray it in your towels. So make sure it's white if you're going to use the bleach though. Now also, make sure you have vitamin D. It is proven research and proven hospital studies that a lot of the COVID patients are D3 deficient. So you want to and they gave them vitamin D and their symptoms improved. So get you some vitamin D. You want to also get you some vitamin C. Vitamin C has always been good for colds, to avoid cold symptoms. So it's also good for the coronavirus because it's in the same kind of family, except it's just a whole another different animal, which is worse than the flu. COVID has killed way more people than the flu could ever do. So remember I told you, I said that the research for the children for 10 years of the flu deaths was 189, but 1 year of COVID was 279. So you got 10 years versus 1 year. So this is something we have to take serious. I know everybody's frustrated. Everybody's tired. But you have to protect yourself. You can't gather and run out there. I know they're opening things. I don't agree with it. So I'm teaching you some safety precautions because I don't think they should open, but they're opening. So protect yourself. Don't be gathering somewhere, especially in closed environments. That is very dangerous. It increases your risk to get COVID if you're in an enclosed environment. Try to be outside. Make sure you're at least 6 feet or more apart. Now, there's research that proves that inside a restaurant, someone coughed, it can travel up to 22 feet in 90 seconds. So depending on the environment that you're enclosed in, it could be a lot worse than if you were outside. But still, when you're outside, I still think you should social distance. I still think you need to wear your mask. You have to protect yourself. And the adults, parents, you have to get your vaccine. There's not enough people vaccinated. Do your research. It's all online. The Pfizer and the Moderna is made from the mRNA protein. Doesn't have COVID in it at all. It has the protein that will trigger the response to build the immune system in case one comes to your body. So it doesn't have COVID in it. It just doesn't. And then as far as the Johnson & Johnson, it has a different dead type of virus than the COVID. That's what they use in their products. So there's plenty of research out there. If you got your shot once, people was trying to go travel, right? For Easter. Go back and get your second dose because you need your second dose to be fully immune. You have to. And they say it's about 6 months. So we'll find out. It's forever changing. They're forever going to update us. I heard CDC is going to come out with some different guidelines tomorrow. But isn't it better to be safe than sorry? Of course it is. If you're going to gather, get your vaccine. If you want stuff to reopen fully and you want everybody to be protected, everybody needs to get their vaccines. That's the only way we're going to be fully protected And even then, we may have to keep taking these shots every year like we do with the flu shot. But at least we have a better chance, and at least you have a better chance of getting, if you do get COVID, that you don't get serious illness from the COVID and possible death. So, and if you have COVID and you still have lingering symptoms, which is the long haulers, as they call it, meaning the symptoms just keep lingering on, you're more susceptible to get COVID again, and then possible deaths up until 6 months, according to the research. So I don't want people to think, oh, I got COVID and I'm good. No, you're not good. You're actually increasing your risk for your safety. So stop going out there thinking you're invincible because you have the vaccine. And you definitely are not immune unless you have 2 doses. Now, you can reach me at healthyliving.company. There's my website. I have several products. Keita's egg toast gumbo. You have to send me a message to get it fresh. Also, if you missed the live broadcast, you can watch it there by clicking on the previous shows. Please subscribe to my channel so you can stay connected. You can also reach me here at the Next Level Studios at 310-549-1113. 310-549-1113. The producer of the show is T Jams, TJAMZ. You can reach him at tjamsmusic.com. And you can also reach him here at the Next Level Studios, 310-549-1113. 310-549-1113. Now stay safe, exercise, wear your mask, get your second dose of your vaccine. If you haven't got it yet, there's plenty of doses now. There's no excuses why not to get your appointment. Get your more than 6 feet apart. Bye-bye. Exercise every day. No excuse for that either, right? wherever you can go until you can go all the way, right? And then you're going to go to the other side, which is good right here for your love handles. These are really good for this. So that's what these are, right? We're going to get into the standing. Okay, so for standing, the most important thing is to strengthen your core, right? So what you can do is, since you're beginning, you can hold on to something sturdy, like if it's the top of your dresser or a chair that's not moving, and hold yourself up on one leg. Try to do it for at least 30 seconds, because what happens is your abs